This is Good Morning San Diego.
Still ahead on Good Morning San Diego. We're going to learn more about the latest discoveries in breast cancer research.
Welcome back to Good Morning San Diego. Your time is 8:41. Dr. Christine Horner is a board-certified surgeon and renowned preventative health expert and author of Waking the Warrior Goddess. She's here this morning to discuss who is at risk of the breast cancer virus, how you can get it, and preventative strategies. Good morning to you.
Good morning.
So it is Breast Cancer Awareness Month, so we really need to know the things that you're talking about this morning, how to prevent it, if we can prevent it, who's at risk, and what we do after we get it.
Absolutely. So I was a plastic surgeon, and I used to do a lot of breast reconstructive surgery. So really, I was kind of on the cleanup crew, as I said. And I noticed that my patients got younger and younger until finally I was doing women in their 20s.
Wow.
And then my own mom got breast cancer and died from it. And I thought, you know, people really need to know what they can do to help prevent this. And so I went through the medical research and found exactly why we have a breast cancer epidemic, all the things that we're doing to contribute to it, and the things we traditionally don't do in this culture that are highly protective, and they were all natural.
Reason? Why are we getting it?
Food, diet, and lifestyle, you know, predominantly. So that's the good news, because 95% of breast cancers can be preventable through diet and lifestyle, and there's simple things that women can do that can cut the risk in half or even more.
Stay away from what?
Red meat, sugar, saturated animal fats. Yeah, sugar, you know, actually sugar just fuels breast cancer. It's the favorite food for breast cancer. So
I have such a sweet tooth. That's why I'm kind of going.
Gonna have to work on that one.
I guess so. My goodness.
Yeah.
So, but that's pretty, you know, self-explanatory. You know, eat right, exercise.
Exactly.
Live as healthy of a lifestyle as you can.
Right, yeah. So, you know, all the things that we traditionally know that are contributors to all diseases contribute to breast cancer. So minimizing stress, going to bed at the proper time, you know, exercising, as you mentioned. But in addition to that, you know, what's really great is that even if you can't change your diet and lifestyle right away, there's a variety of different supplements and herbs and foods that have profound effects at lowering your risk.
Really? And you brought a few examples this morning, right?
I did. So the first one is called AHCC, which is a mushroom formula. And what we know is that our immune system is something that gets knocked out by sugar and also by stress and toxins and so forth. And when our immune system gets knocked out, that's when cancer cells can start to grow. And because normally our cells are recognizing it. So in order to beef up our immune system, they found that mushrooms are something that are very, very effective. AHCC is a particular formula that's my favorite. It's got a variety of different medicinal mushrooms, and it's formulated in such a way that the molecules are very small, absorbs into our system more rapidly. And so what they found is that AHCC will help to modify all the different cells in our immune system, make them stronger. And so people who take it on a regular basis have a much lower incidence of all sorts of different kinds of cancers. If you take it, if you have cancer, it actually improves your survival statistics. So very, very important. The other thing is vitamin D. So we're lucky here in San Diego to have sunshine, but in the rest of the country we don't have so much. But vitamin D is something, you take a vitamin D supplement, you cut your risk in half.
Wow, that's incredible. Okay, we're running out of time, but quickly, you brought some turmeric, you have broccoli over there. What are the seeds?
And flax seeds. So flax seeds are considered one of the most important foods that you can consume to help lower your risk.
Your book quickly.
Yeah, so this is my book, which is called Waking the Warrior Goddess. And it actually won the best health book of the year in 2006. Brand new edition, and it has everything I could find in research that helps to lower your risk, either what you should avoid or what you should favor.
And will you quickly throw out a number for us? At what age should we start having mammograms?
Never. So I believe that mammograms, because they produce radiation, there's no question that it has saved lives. But there's some techniques that don't use radiation, and we know that radiation can increase the risk. So there's other techniques like thermography, ultrasounds, and a variety of other techniques that do not produce radiation.
And I bet we can find them in your book, right?
You certainly can.
All right. Thank you so much, Doctor, for being here. Appreciate it.
You're welcome.